Morning, my name is Matt Hermeyer and I'm from St. Charles. I've got a 10-year-old daughter. I'm 37, battled several chronic illnesses, have severe back pain and no health insurance. I've been rejected, denied, excluded, declined, and turned down for every type of health coverage I've applied for. I'm in the Medicaid gap, a gap that no one should be in, a gap that needs to be closed. When I lost my job in 2013, I applied for a private plan but was denied coverage for my medical conditions, pre-existing medical conditions. In 2014, when the marketplace kicked in, I applied for the private plan. They didn't turn me away, but I was deemed ineligible for tax credits because I earned under the poverty level. Because I couldn't afford to pay full price for a private plan, I turned to Medicaid. Ultimately ended in rejection. First it was I made too much money. Now they say I need to apply for disability. That's what I need to do to get coverage. But I don't want to be disabled. I'm 37. I want to go back to work. I want Medicaid. I tried to work off and on over the past couple of months so that I could try and purchase coverage, but my back is so bad to the point that last week I couldn't even rake the leaves in my yard. Again, I want to go back to work, but in order to do that I need health insurance. I need to be able to have my back looked at. I need to be able to see specialists. And without the medical treatment, it's just getting worse. I can't work the jobs I used to, and I keep getting stuck in the gap. Even though I've been on the sideline every day, I try to improve the situation, hoping something's going to change. I've enrolled in coursework for EPA-sponsored classes, environmental remediation, sponsored through SLU. The goal is to get back to work doing something that doesn't affect my back, but still, without medical treatment, I'm running out of options. Because I'm always trying to help and change things, I'm hoping my testimony will help to change some people's minds, encourage some action, and hopefully work towards the expansion of Medicaid so that I have a chance and people just like me. Thanks for your time.
Thank you for the opportunity to let me speak today. My name is Joanna Strong and I am from Springfield, Missouri. I am 55 years old and I'm considered totally and permanently disabled. In February of 1999, I went to my local hospital because I had been having severe migraines and feeling extremely ill. I was diagnosed with a serious case of meningitis. At the time I was diagnosed, I was a small business owner with my own window cleaning company. I was uninsured because I wasn't making enough to pay for insurance. Eventually, after about 6 months, I was unable to pay the neurologist and the hospital and was forced to stop treatment, even though I still had inflammation in my brain. Over the next several years, I tried to get coverage through Medicaid, but had no success. I worked intermittently for about a year and a half doing window cleaning and made some income, but I was never able to get health insurance. The meningitis left me weak. After a series of medical issues, the doctors at the clinic told me I should not work. But I had no choice. For the next decade, I worked back and forth and stayed with friends to get by. I had no access to care and sometimes no access to even fundamental living needs. There were points in time where I was even forced to rely on homeless shelters and live in my car. As a result of never receiving the proper care for my meningitis and having to work despite my condition so that I could try to provide for myself, I was officially deemed totally and permanently disabled and finally eligible for disability income. All of this has led to my inability to work, which would have been time that I could have been paying taxes back into the government. I believe not offering Medicaid to people robs the state of its own economic growth. There's no telling what I might have been if I would have been able to get the medical care that I needed. I fully believe with all my heart and soul that if I had been given the opportunity to have Medicaid benefits earlier, I would not be physically disabled and would be far better off than I am today. I come to you today to ask that you, please, consider Medicaid expansion. Thank you.
My name is Sammy Strongi, and I'm a student at St. Louis University School of Law, as well as a volunteer with Missouri Healthcare for All. Over the course of the past year, I've had the opportunity to speak with several Missourians about their experience with our healthcare system. Through this experience, I've encountered many hardworking people who are trying to gain access to affordable healthcare, but are still struggling to meet this need. Today, I'm here to tell you the story of one of these people, Linda Palmer, who is doing her best to make ends meet, but even as such, still does not have access to affordable healthcare. Linda Palmer worked for 11 years, serving the state of Missouri's Youth Services Division and working in a homeless shelter in Texas. In Missouri, she helped juvenile offenders go to school and counseling through the Watkins Mill program, and in Texas, she helped teens who were aging out of the foster system find safe housing and learn job skills. Before that, she raised 4 children with her husband. In 2014, she moved back to Missouri, and she now lives in Bates County. At age 61, unfortunately, Linda was laid off from her full-time job. She has been looking for work since then and doing substitute teaching, but hasn't been able to find a full-time position. After a year, she began drawing her early retirement, but she is still below the poverty line. As she says, "It's very scary for me to not have any health insurance. I'm healthy, but at my age, you never know what's going to happen." Linda is proactive about her health. She paid for a flu shot, and she sought help from a navigator at a hospital in the hopes of getting affordable insurance. But the best she could find was that the hospital agreed to list her as a charity patient, so 80 to 90% of her bill would be covered by the hospital if an emergency were to happen. "I've never not had health insurance before," Linda says. "I never would have expected this to happen. I just have to hope I stay healthy until I turn 65 and can start Medicare." Linda can't be here because, fortunately, she has a substitute teaching job today. She couldn't miss it because it is not steady work. And there aren't many businesses or other opportunities for jobs where she lives in the rural area. She's worried about what happens this summer when school isn't in session. Linda is optimistic. She's smart and a very hard worker, and she's in the Medicaid gap. I'm asking you to think of Linda and others like her and extend Medicaid coverage to all those below the federal poverty line. Thank you.
My name is Dr. Heidi Miller. I'm a primary care doctor, and I work at the Family Care Health Centers in St. Louis. We're a community health center that takes care of patients regardless of the ability to pay. We provide as comprehensive services as we're able to under primary care infrastructure, but I am only one part of a broader medical system. The patients who fall in a coverage gap are working their bodies so hard that they're coming to me with musculoskeletal complaints and issues that are directly related to the fact that they are waiting tables, driving a shuttle bus and carrying really heavy luggage all day long, catering, house cleaning, the list goes on and on. Most of my patients who don't have insurance work, and they don't have the insurance to keep them healthy enough to work, and sadly it's actually the work that is wearing down their bodies, so they need it even more. So for example, I have a couple of patients who are waiters, and as you get older, it's not uncommon to develop arthritis at the base of the thumb, but if you've spent your whole career lifting up 20-30 pound trays, that arthritis happens much faster. That one joint and the need to perhaps surgically repair that joint is the difference between someone being able to keep their job or not keep their job. And the saddest thing is when I know that one surgery could correct that musculoskeletal problem with an orthopedist and that they would be able to recuperate and go back to work. But without insurance, I cringe when that patient in pain says, "Doc, will you fill in my disability paperwork?" Not only does this disability make my patients historically depressed, I mean, most of my patients, not only do they work, but they want to work. They want that sense of utility, they want that income, they want to contribute They want the economic independence. But in some cases, the only way that they can get the surgery for the excruciating thumb pain that actually keeps them up at night as well is to apply for disability, get for disability, and then request Medicaid. I hate that. And I cannot count the number of patients that I've had who want to work, would prefer to work, and it would cost the system so much less if we could just do that one issue and help them work. I wish our policymakers could look behind my exam room doors and see really, really hard people struggling, and that people are trying to feel well so that they can work well. I wish that they understood that. I have been at the same health center for 13 years, and I continue to be baffled at the incredibly sad stories of patients who are suffering but trying so hard to persevere. I wish they understood that. I think there's a misconception that Medicaid perpetuates poverty and welfare. But what I've witnessed in the clinic is that sickness perpetuates poverty and welfare.